everyone, my name is Laura Vandenboer and I'm your host of Healthy Living with Laura. Today we are here with Jackie Sinkledam of Eramosa Physio. Jackie's a senior partner and a registered physiotherapist, so I'm super excited to be here and kind of hear about your business and your experience and what you guys have to offer.
Well, what brought me here? So here is 22 years later.
Okay.
I am a registered physio, and 22 years ago, my original business partner and I decided that we really wanted to have a unique practice where at the time we felt we were really setting a higher standard for physiotherapy care. So 22 years ago, we opened our first clinic that happened to be in Guelph. But as far as locally, we've actually been here in Centre Wellington now for, I think, about 12 years.
Okay.
It seems like a lot longer. Yeah. So this is one of 10 locations now for us.
Okay.
So we're in 7 different cities, and we have the 10 locations. And yeah, we're very excited to be on the show. And
that's awesome.
And certainly happy to answer any other questions about.
Perfect. So I know you guys have a few different, so most of your clinics are under Eramosa Physio, and then you've got a couple extra.
Yeah.
There's a new clinic in Guelph, is that right?
Yeah, so I mean, all of the clinics typically are branded Eramosa Physiotherapy. Okay. Sorry, we weren't that creative with our name. I'm originally from Guelph. Our first clinic was on Eramosa Road, so that seemed like the name we were going to choose. Yeah. In part, we didn't have the grand plan to have the locations that we do have. Okay. But interestingly, part of our philosophy was creating an environment that was a mentoring environment for our clinical staff. And what we ended up seeing happening was that we were attracting physiotherapists that also shared that philosophy about wanting to have a higher bar. Okay. But some of those physiotherapists actually wanted to go on and have their own sites.
Okay.
So they were really excited about carrying on our philosophy of practice, and we ended up with all of these locations. So of the 10 locations, 7 are called Eramosa Physiotherapy. Okay. The second clinic that we opened was actually on campus at the university. Okay. So Eramosa Physiotherapy represents the physiotherapy within the Health and Performance Center. So that clinic is branded as the Health and Performance Center, and it's a unique clinic that we've had an incredible learning experience from because it's multidisciplinary. Okay. We get to work with a lot of different disciplines. We get to work directly with sports medicine, orthopedic surgery, so that's been a great learning environment. And our more newer location is called Guelph Women's Health Associates. Okay. And that was a clinic that really stemmed off of our pelvic health programs. Okay. So all of our Eramosa sites, including our Elora location, have really unique pelvic health programs with really great physios that are running those programs. Okay. But what we realized was it's such a unique program that it really could benefit from its own space. So we tried to duplicate what we saw working really well at the Health and Performance Center, and we wanted to create a really comfortable, safe environment for women, but anyone can access the clinic. Okay. That brings in other professionals that also have a unique interest in women's health. Okay. So we have our physiotherapists there that are doing a lot of pelvic health physiotherapy, but also address other women's health issues that could be things like osteoporosis or breast cancer or heart disease. We have a naturopathic doctor that works within our group. We have Pilates, yoga. We've really tried to bring who we felt were real leaders in the community, at least under one roof. Yeah. And the other clinic location is on campus at Conestoga College. Okay. So that is within their student wellness center. So similarly is branded a little bit differently, but they all run with our philosophy of practice, and thankfully we have this incredible pool of physiotherapists to draw from, and that's really how they all were built.
Oh, that's awesome. And so today we're here in Elora. Is there anything that you guys specialize in here at this specific location, or that you guys focus on?
I think Elora is actually pretty representative of a lot of our other clinic locations, in that we actually offer almost all of the programs that you would see at any one of our sites. at all of our sites, from what we call an orthopedic standpoint, we're going to treat from head to toe.
Okay.
I'm sure that there's not a joint or muscle that we don't have a positive effect on, or I've actually personally experienced helping people through. But our top areas for treatment at this clinic are going to be around shoulder pain, back pain, and knee pain. We certainly treat everything else, but in a day, in any given day, we're going to see a lot of those type of clients. But this clinic's unique in that we also have, out of the 4 therapists, we have 2 therapists that have done their pelvic health training, which those courses are postgraduate courses, so not every physio that graduates will have those credentials. So we have a great pelvic health program that's targeting both male and female incontinence, pregnancy, prolapse, sexual pain or pelvic pain. So we really cover quite a spectrum in pelvic health. And then we have all of our physios, but in particular, we have a clinical lead, Rachel, that's running our concussion program.
Okay, awesome.
So we spend a lot of time in the community, really with that emphasis on recognition and prevention. And certainly there is a treatment aspect to concussion. And that's a really nice area that we are able to draw from our experiences at the Health and Performance Center. That particular clinic sees a lot more than what we would in Elora. So we're able to take those experiences and mentor some of our other physios. And then other really kind of unique things at this clinic, again, Rachel has incorporated Pilates into her practice. So that is a nice, unique exercise prescription protocol that, again, not every physio is going to have that as a tool, but it's a great tool when we look at, treatment of back and hips and posture. So that's really neat. Derek's done some advanced vestibular training, and vestibular is kind of a big word, but it's a word that we look at when we're treating clients that complain of dizziness, and sometimes that dizziness is just maybe as a result of neck pain. It could be after a concussion. It could also just be related to some inner ear dysfunction. So again, those are unique courses. And probably what's caught some of our clients' attention recently is that we have this big golfing net out front. Everyone wants to know what the golfing net is for. So again, both Rachel and Meredith have this passion for golf, and they've married that with their physio passion.
Awesome.
Oh
yes, time of year to get all the golfers out there.
I know. And Meredith, she actually is an NCAA golfer, so I've seen her out on the golf course. So it's really nice to see that she can pull those 2 things together and be able to offer that as a unique service. So it's a funny clinic because in our organization, Elora is often referred to as a rural clinic, meaning that, it's kind of a removed from things, when really in the grand scheme of things, I think it's a clinic that houses a lot of our gems as far as our physios and the programs that we offer.
That's awesome. That's so exciting. So I know we're going to go over a few different kind of common things that you guys see, but can you maybe touch on how you become a physio, and maybe what your educational background is, and then we can get into that. So I mean, thankfully for me, it was easier
23 years ago. In part, the process of becoming a physio has really produced some exceptional physios. It is a bit of a longer process in that in Canada, you need to finish a postgraduate university degree. Most universities don't give a preference for the type of degree that it is. I think if you're going into a physiotherapy program and you have a science degree or a biomed degree or a kinesiology degree, those are going to give you an incredible foundation for the physio program, but are potentially also going to be more challenging degrees to get the marks that you need to get in. We were just talking about this at one of our partners meeting. One of our volunteers that applied to physio had a 92 coming out of university, did not get an interview.
Oh my goodness.
So again, I'm very thankful that I did not have to experience that. So
it's a very competitive.
Very competitive program now. Most universities have accelerated the physiotherapy degree that was once a 3-year degree postgraduate program into a solid 2-year degree. So you're going to school solidly for 2 years. And you'll have an academic and a clinical component. And then once you're finished physio, you know, the deal is not sealed in that you do have to pass our national exam.
Right.
Which actually has a very high failure rate.
Okay.
So the actual national exam has posed some challenges
Right.
for physios as well.
Okay.
And then during that process, you can work as a resident physiotherapist under supervision of a licensed physiotherapist.
Okay.
And then once you pass your national exam, then you can sit back and enjoy life a little bit.
Well, and then there's still all these courses that you can take along the way, right?
Yeah,
so
that's so
it
true.
probably
I mean,
never stops.
It is definitely the lifelong learning profession. I can say that with complete experience, to think that that's really what's kept me entertained for 22
Right.
years, is that you are always learning something new, and just when you think that you actually have all the tools that you need, you run into that client that you think, you know, I need to go do a little bit more research or
That's awesome.
take another course.
Awesome. Well, let's reset here. We're gonna go over a few common things that you guys see, and then we can go over that.
All right, we'll do that. So I mentioned earlier that the shoulder is our #1 joint that we treat at the Elora location. So I want everyone to picture this is their shoulder, because I think a lot of people don't realize that the shoulder joint is largely formed from our shoulder blade or our scapula. And then we've got our humerus, which finishes at the top with this ball that's actually in the joint of the scapula. So these two bones are really, really important for shoulder function. And the scapula itself is an interesting bone because it just kind of floats on our rib cage. It's really not attached by anything but all of the muscles. So you can see why when we're treating the shoulder, how the exercise part of it is super important. So when we look at a lot of things that we treat, our philosophy with treating many, many different areas of the body is to try and hit 3 pillars. One is going to be on manual therapy, where that is often when your physiotherapist is going to actually be touching the person. The second pillar is exercise. And although exercise is probably the least favorite part for our clients, it's actually the part that has the most incredible amount of research to support it. So we always want to have a good exercise component. And then education. Anytime we're treating any type of joint, it's really important for us to be the teachers and to be able to explain to our clients what is going on, and more importantly, how they can prevent it. So in the shoulder, one of the hands-on techniques that we would use, we call glides. So in this maneuver, what we're trying to do is we're trying to encourage that humerus or that ball in the shoulder blade to slide downwards. So if we found, and I'm going to get Rachel to shift a little bit closer towards me, if we found that when someone moved their shoulder, so if they were lifting their arm up, we'll often find that people will have pain in this shoulder height range. So we'll want to go into the shoulder and we'll want to assess that ball at the top and just feel, is it actually sliding down like it should? In the event that it isn't, what we'll often do is we'll add what we call a glide or a pushing down movement on that ball. And this is the manual therapy aspect to treatment, and it's important because a client can't do this on themselves. So this is where that hands-on component can really get at those areas where someone wouldn't be able to do it on their own. So I'm going to get Rachel off the bed, and I'm going to show one of my favorite exercises that would complement the treatment of the shoulder, in particular a rotator cuff tendonitis. So we'll get you standing up. And we're going to move to our area of TheraBand. So come on over here. We'll get you to face this way. So again, if you think about that model, we have Rachel's shoulder blade. That is really the foundation bone that all of the muscles are pulling from. So we need the shoulder blade to stay in the most ideal position, which is often why, you know, having that cueing and making sure that you're doing your exercises properly is really what's going to make your exercises successful. So we're going to set Rachel up. So Rachel, you're going to remember to keep your shoulder blade still by pulling a little bit and then just lifting a little bit here. We want to give lots of space for those rotator cuff muscles. And this is a very common home exercise that we would use. So I'll get you to pull a step away from the pulleys a little bit. So we're gonna set that shoulder blade up. We want our clients to get lots of cueing. This stays nice and still, elbow stays tight to your body, moving out in a range of motion that's always in control and typically is fairly pain-free. That feels okay? Great, perfect. And that's going to give a little bit of insight to how we would address the shoulder. Okay, so we've talked about the shoulder, we've talked about 3 pillars that we try and target, and that's going to be manual therapy, exercise, and education. So now I'm going to demonstrate a low back technique. Again, from a manual therapy perspective, we're often trying to target areas where the client wouldn't be able to get to those areas on their own. So in this example, I may be dealing with someone that these little joints here, and sorry, my spine's a little bit crooked, but these little joints here, the stacking joints, they're called facet joints. And often what we can see, sometimes because of posture changes, sometimes it could be arthritis in those joints, but we can get a little bit of compression in those joints that can lead to pain just locally in the joint. But sometimes that compression can actually pinch these little nerves that come out, and that gives people those symptoms of pins and needles or numbness that often go down one leg, and a lot of people refer to that as sciatica. So from a treatment standpoint, just like the shoulder, we want to assist people with that manual therapy aspect of treatment. So normally if someone was coming in for treatment, we'd actually have them a little bit more disrobed so that we could really be close and feeling those joints that we want to treat. I'm just going to hold on to my shoulder. And we'll tuck you underneath there. And all we're trying to do here, again, is just give that little bit of a local emphasis to what we want to open up. So, and this is just the activation of transverse abdominis. We always have to make the exercises harder, and we have to put people in positions that would meet their goals. We're gonna flash way ahead of our exercise prescription so that I can give Rachel the opportunity to demonstrate on me a more advanced transverse abdominis strengthening that would actually involve using the reformer and how Rachel uses Pilates in her physiotherapy practice.
Okay, so this is Pilates reformer. So it's a funky machine that we can use to progress some of those exercises that Jackie was speaking about earlier. So there's springs that are here that I can change the resistance. So Jackie, I'm gonna get you just to bring your feet a little further apart. Yeah, good, so they're about hip distance apart. And then I want you to think about finding your neutral spine position. So that's gonna be the spot where there's a little space between the carriage and the small of your back. That's where we're gonna get the transversus abdominis turned on most efficiently. So I want you to think about pulling that saran wrap that you were speaking about earlier tight across those hip bones. Okay. You're gonna hold that position, and then on your next exhale, I'd like you to push through your feet and push the carriage away. Good. And then inhale and coming all the way back into the stopper. Good. So in this exercise, we're trying to challenge that transversus abdominis by now creating some lower body movement. So we're getting some strength in through the legs, kind of like doing a squat, but we're challenging that pelvis to stay as nice and stable as you can, which is gonna help for functional activities. Good, and then maybe just do one more there. And then inhale, come all the way back in. Good, and that's the reformer.
Okay, so we'd also like to highlight a completely different area that you would see at the Elora location. And as I mentioned, we probably literally treat from head to toe. So we're gonna highlight some concussion treatment, which is our head. And we're really grateful to have these resources in Elora. As I mentioned, we pull a lot from our experiences at our Health and Performance Center site. But it's really important for us to have a consistent message in the community that concussions are a mild brain injury. Thankfully, most concussions do resolve. So not everyone that has had a concussion will need to have treatment. But we really want to move towards the message that it's no longer acceptable to assume that after a concussion incident that we're just going to put someone in a dark room and let them be quiet for some mysterious amount of time and hope that things resolve. If people are having persistent symptoms, we absolutely have tons of Canadian research that comes mostly out of the University of Calgary in conjunction with a lot of studies that have been done with Hockey Canada that show that athletes that access physiotherapy and have treatment directed towards their cervical spine, their vestibular system, their eye tracking system, when you actually introduce treatment to those systems, we know with certainty that we can get athletes better quicker and return them to a healthy sporting state. So Rachel is our concussion lead in Elora. So she's going to demo a very, very small component of how we might assess someone's what we call vestibular ocular motor system. And that whole assessment is often used as part of exercises for concussion patients.
Okay, so we'll go through 3 different visual tasks that we use to test people. So Jackie, sitting up nice and tall there, I'm gonna get you to look at the butterfly on the stick, and without moving your head, I just want you to track that stick with your eyes only. And as you're doing this, just let me know if any symptoms pop up. So any dizziness, headache, nausea, or fogginess.
Nothing.
Nothing. Perfect. Good. Now the next one, I'm going to hold my fingers out like this, and without moving your head, I want you to flick your eyes back and forth between my 2 fingers as quickly as you can while keeping them in focus. Good. And same thing, just asking if there's any symptoms that pop up.
No.
No. Good.
Not that easy to do, but
Yeah. And we're going to do the same thing up and down. Good. Good. And then one more visual task, looking at the butterfly again on the stick. I'm going to bring this in close to the bridge of your nose. I want you to let me know when you see 2 sticks.
Okay.
Okay.
Maybe there.
Yeah, good. And then coming back out. Good. And then we would just record the distance at which that occurs.
Perfect. Okay, the last area that I wanted to highlight as an area that physiotherapists have an incredible skill set for, and in particular that we offer at our Elora site, is our pelvic health physiotherapy. So as I mentioned, our pelvic health physiotherapy is going to target people that are suffering from incontinence. That often happens to women after having any babies. It also happens to men after they may have had their prostate removed after some cancer treatment. Definitely happens to women as we get older and our amounts of estrogen are changing. Just because it happens does not mean that it is a normal situation. In fact, it happens so commonly that for a long time we as women, and I think in medicine, just assumed that it was a normal function. But when we look again at that incredible body of research, we know that if we intervene, we can actually get rid of people's complaints and bring them back to that normal state. So when we think about pelvic health, we're thinking about incontinence, we're thinking about treating women while and after that they're pregnant. We're also thinking about treating people for pelvic pain, and that may be specific to sexual experiences, and it may be unrelated. It could just be pelvic pain in general. And we're also thinking about prolapse. And prolapse generally creates a very heavy feeling for women that can become quite uncomfortable, but can also deter them from doing so many activities. So from a demonstration point of view, I thought we could look at the actual pelvis itself. And I want everyone to feel really comfortable and confident as to what happens when you come in for pelvic physiotherapy, because I think that that's a barrier for people. People are wondering what exactly is going to happen when they come for physio. So the first thing that happens is the same thing that would happen if we were treating you for your shoulder or your back or after a concussion. We're going to take a very detailed history and hear why you're at the clinic. And then very often in a pelvic physiotherapy exam it's going to start off like a low back exam, because so many things on the outside will also influence your pelvic floor. What's unique to pelvic physiotherapy is that there is an internal component to the exam. So if you look at our pelvis, we're going to have our tailbone at the back, we're going to have our pubic bone at the front, and then in the middle, or not really the middle, at the back by our tailbone, we're going to have our anus, and then we're going to have our vaginal opening. This layer of our pelvic floor is our superficial layer and can often be a source of pain. So when we do our assessment, we're going to be touching these areas and seeing, does that reproduce someone's symptoms? Are those tissue areas tight? Is there anything that we can do to manually stretch out that area that would help with the person's complaint? If I take that layer away, we actually get to see the really powerful, deep pelvic floor muscles. And these muscles are definitely the muscles that a lot of people are familiar with when they say that they have heard about a Kegel. So a Kegel exercise is often talked about, certainly amongst women, and everyone tells me that they do it at the stop sign and in different kind of checkpoints in their day. But interestingly, in our exam, when we're doing our internal component and I'm actually touching these muscles, I would hazard to guess that 95% of the clients that I see will tell me that they've already done Kegels and that they don't help them. What's really good is when I'm actually touching that muscle, I can ask them, okay, this is a great time, show me what your Kegel looks like. And when they demonstrate it, if I don't feel this muscle move, which is typically what happens, then we know why their Kegels aren't working. A lot of women, when they have to demonstrate their Kegel exercise, they'll squeeze the outside glute muscles or they'll squeeze their inner thigh muscles. And you can tell from this model that all those muscles that are surrounding the pelvis, they're important muscles, but they're not going to give the support to the pelvic floor. These are the muscles that we would need to incorporate. So just like the shoulder, just like the back, our manual therapy techniques are going to work at releasing areas that are tight. Sometimes I'll do some tapping or some pressure to help create some awareness so that women can actually find those pelvic floor muscles. And once they actually find that contraction, because they feel me giving them some cueing on that pelvic floor muscle, a light bulb goes off for them. Then they know, okay, now I know how to do a Kegel. And then just like transverse abdominis, we're going to progress those Kegel exercises. So we may start off teaching women and having all of our clients be confident with doing a Kegel exercise while they're lying down, but that's not necessarily going to help them if their goal is to play ball hockey. So we have to take all of our exercise prescription to the level that meets whatever our clients' goals are. With all of the joints that we've highlighted, I hope that everyone can see that certainly the profession of physiotherapy gives incredible variety. We treat so many different joints throughout the day, but it doesn't matter what area that we're treating. We're really focusing on our 3 pillars. We're going to have a manual therapy component in some capacity. We're going to teach exercises that are going to be able to rehab the area and give our clients tools to prevent the reoccurrence from happening. But more importantly, if they do have a flare-up, potentially give them tools that they can actually treat themselves. And the last component is the education piece. I really feel that as physios, we have the opportunity, because we do spend some quality time with our clients, that we can explain the whole disease process, we can explain how you can return to that normal state, and again, importantly, how we can prevent the injuries from happening again.
Well, thank you so much, Jackie, for having us and showing us around the clinic and explaining to us some of the common things that you guys see. I think it's a really, you guys showed us a lot, and it kind of shows us the span of what physio can do for us.
I really hope that that is the message that is out there, that everyone needs to have a physiotherapist in their tool belt, because we are the body mechanics.
Yes, oh, for sure. Well, thank you again, and I'm sure everybody will be learning lots from your segment, so that's awesome. If you are a healthcare professional or work in the wellness industry and you would like to be a guest on our show, please contact me, Laura, on my email, alignpodorthics@gmail.com. Thanks, and we'll see you soon.